most famous physical therapist on the internet.
Hi folks, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together we have the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Today we're going to show you how to stop shoulder pain fast. We're going to show you 3 options for at-home decompression exercise. Is for impingement, arthritis. It really, most problems, unless you have an unstable shoulder.
Right.
I really won't want you doing that.
But you got to follow our instructions on how to do it.
Right. So if you're new to our channel, by the way, please take a second to subscribe to us. We provide videos how to stay healthy, fit, pain-free, and we upload every day. Also go to bobandbrad.com. Go to the giveaway section. We're on hiatus for 1 day.
Hiatus?
Yeah, we're going to start again tomorrow.
Isn't there a country named Hiatus?
Haitian?
Haiti. Oh, sorry about that.
Just go to bobandbrad.com and, like we said, giveaway or Facebook. The contest will be pinned to the top of the page starting tomorrow. Is it the mattress tomorrow? Oh yeah, big thing. Check it out. We're giving away a mattress.
Sleep Ovation.
A new one too, not a used one. So you can also go to Twitter, Instagram, or TikTok if you want a 60-second version of our program. We've been already talking enough, Brad, right?
Yeah, we had complaints of the used ones.
Yeah.
Anyways, so shoulder decompression, it's really traction. This is nothing new.
Right.
There's different names for it, but this has been going on for decades, and there's been a little changes throughout the time. But we're going to show you 3 and actually 3.5 options that you can do at home. It's very important that none of these create any pain. They should feel good while you're doing it and afterwards. So don't get too aggressive. Start out gently. And the whole goal is to take the joint, the shoulder joint, and relax the muscles, maybe slightly gap the joint so you get synovial fluid in there, increase circulation as a result of that. And
if you do it over time, you actually could be reshaping things.
Right.
I mean, some of these, you could, like to the point where, like you can move teeth with braces on, you know, you can actually move the bone a little bit, or the ligaments especially.
Right. Yeah, and that's actually explained here in this book by shoulder surgeon, Dr. Kirsch, that we have for one of the options.
And we'll go into that more when we talk about the hanging.
Say no more. So, should we get right into it,
Yeah,
Bob?
let's go. So the first one, Brad and I have been doing for years. I mean, therapists have been doing this for years. It's a great one. We, you know, like after surgery, and if you're just having some pain, it's the one you start off with. You're trying to get some motion in the shoulder, and you're trying to get it to relax.
Yes.
So you start off, it's called the Codman's or the pendulum exercise. You're going to lean on a chair. You're going to work this shoulder. Now watch my thigh. You can actually see that I'm not moving the thigh at all.
No.
But the pendulum, my body is moving it. And that's what works best for your arm even. Don't be like this.
Right.
Actually let the pendulum move it back and forth. And you can go back and forth this way. And you're going to go in a circle. Am my thigh going to go in a circle?
Yeah, you really got to get that body moving. The whole goal is when I explain this to my patients, I say, pretend your arm is like that thigh or like it's completely jello. There's no muscle in it. It doesn't move unless the body moves. And then the weight of your arm serves as the vehicle for traction.
Distraction and also for relaxation. Because those muscles tend to get tight and painful. So again, forward and back, side to side, and circle one way and circle the other way.
Right. You're going to spend maybe 1 to 2 minutes there at the most.
It's a good one to do throughout the day.
The further you bend over, I always have people lean on something with a hand so your back doesn't get sore, just in case you have back problems. You can actually do it from this angle and work your way down.
That's one thing I forgot to show Brad, though. That this is one of the things. It's a sneaky way of getting motion too.
Sure.
So let's say I can get it moving up to here. If I stand up, look how far my shoulder's up.
Right.
So it's a sneaky way of getting motion in the shoulder too. That's why
we're not recommending that you do that.
No.
Unless it doesn't hurt.
Right. But we're showing you how much motion you actually are getting.
That exercise has been given for more. You could try that pretty much with any sore shoulder, and it'll probably offer relief.
Right.
Unless it's some unusual thing. But doctors give that so many times. Without even telling you to go to therapy. The next one, however, this one is a little more aggressive, oftentimes used for impingement. So if you have pain here and over that, it's probably an impingement. This one does, and we're using the book that I referred to before.
Again, shoulder pain, the solution and prevention. We'll have a link below. Dr. Kirsten, really, he's a retired orthopedic surgeon, really cool guy.
Yep.
And it also works well for rotator cuff injuries.
Yes. Yes.
So he has example after example and testimonial after testimonial that talks about how this works.
And this could be used for frozen shoulder. Depends on what phase you're in.
Yeah, if you're in the thawing phase, not the unthawing phase.
If your shoulder only goes this high, it's not going to work. But if you're up to about here, you can start to do this, and you can use a pull-up bar.
Right.
Okay. If this was a pull-up bar, and it's nice to not have it so high you have to jump for it, so you can just grab it and gently let your body down. We found the next thing better than a pull-up bar is actually have these hanging handles. One of the reasons I really like them is because I can lean up against the wall, so my posture is perfect, and I can slowly slide my body down against the wall to get the traction I want. Because when you first start, you don't want to, have your full body weight. Again, no pain. So if I go down, I got 50% body weight. That might be comfortable, but I go further, then you get pain. Just go to where it's not painful, and then after a few days of doing this, it will. And I'm actually treating this. I have an impingement problem on my left shoulder right now from swimming. So I'm treating it right now. So I'll do a little treatment right now. And I feel comfortable doing this. Actually, it feels good. And I'll hold it for 15 to 30 seconds. And then you'll give it a break and maybe do it 2 to 3 times. The book is excellent. I think it's only like $10. If you got a shoulder problem and you want to get to the details, you're welcome to get one of those. The next step is the Statue of Liberty.
Right. You could do this too instead of hanging. It's pretty close to it.
It does similar action on the shoulder.
We have the Booyah stick here. You could use any stick as long as it kind of got grip on it. I mean, it would need like maybe tape on the bottom or
Yeah, or you could use some of this stuff right here.
Sure.
Shelf liner. Something you don't want it to slip on the floor or the chair. You'll see.
So if you're shorter, you can actually probably put it on the floor.
Yep.
And let's say my shoulder only goes up this high.
Right.
So what you're going to do is you put it in place here, and you're going to lean forward like this, and you can see how I'm actually pulling on the shoulder and getting traction.
The humerus is pulling this way, a little traction on that joint, and you can control. That's a really nice thing about this. You can control the force by how far you lean. If it gets really good, then you can bring the
I was just going to mention, Brad, with arthritis, I've had many patients that started with this, and they were only able to get the arm up this high, and they started by this, and they love it because then they can see the progress. Like, oh, now I can go up a little higher.
And we should put stripes on the Booyah stick.
Yeah, we should have. We should have like
put some numbers on there.
Yeah. And they worked their way up.
Right.
But yeah, as Brad was alluding to, if you get up on the chair, especially a tall person like me, I can go all the way up now.
Yep.
And now I can lean forward and really get.
Now you're getting close to
now
the
I'm getting that. This is, you can put force on this.
So this is where you really have to have something,
either
a cushion chair or something that doesn't slip.
Right. But this is nice because you can do it without the handles. I mean, you can do it anywhere.
Absolutely. So. All right. And the last one, this one is actually
invented by Brad.
Yeah, so be careful with this one, but I found, it offers some relief to my shoulder. If you have a chair and you have a couple rungs down here, this is a stool, but a chair, and you can take a belt, and you have to get the belt the right length, so I already adjusted it. I'm going to put it right here in the crux of my elbow, put my hand on my thigh, and now I'm just going to lean like this, and I'm going to relax the shoulder, and I'm going to test it. Put a little traction, so as I lean forward, the belt's stationary. There's traction on it now, and if it feels good, I'll hold it for 10 to 15 seconds.
And it's funny, I palpated, which means I touched Brad, and felt there, and you can actually feel a gap.
Yeah,
I can.
Yep, they call it the sulcus sign.
Yeah.
But again, only going to do this if it feels good while you're doing it, and then when you're done, it should still feel good. If it feels good while you're doing it, and then you take it off, it's like, oh, it kind of irritated it. The bet's off. You're not going to do it. It has to feel good before and afterwards.
I actually think this would feel good on arthritis even, Brad.
Yeah.
Because arthritic joint gets some distraction, and it actually can stretch that joint out a little bit.
Capsule.
Yeah, capsule. That's what I was trying to think.
I found that I've been using these loops for exercising at home, I just started recently, but they work good for this. They have a little stretch. It works better than a belt.
Yeah, and I've seen them used for stuff like this
Yep.
many times.
Yep. And so I'm going to adjust it right there and just hold it here. And now there's some give. And it's not like the belt where it's like you bottom out right away. This has a little give. It gives you a little more flexibility, or not flex. I guess flexibility, variation on the pressure.
Right.
So it works a little bit better. I like it. So, anyways, that's it. Again, do all of these. Try them out.
Yeah,
Only
see
do the
which
ones
one
that feel good.
works out for you. If
That's
it
right.
increased pain. The other thing is, if you have increased pain right afterwards, you don't want to do it either.
Yep.
Now, if you have increased pain a couple days later, it probably wasn't this.
Right.
No,
Yeah.
so-
So listen to your body. Do not go after it crazy hard right away. Like, guys, you're the ones that are probably going to do that. Like Bob and I would, but we've learned.
Does your body talking to you? You should listen to your body.
Well, Bob, of
You hear your
course,
voices?
I get in the zone. I listen.
All right.
It all comes to you, Bob.
Peace.
Take care.